Yes, ma'am, it is visible. Okay, ma'am, we can start.
Hey everyone, we are going to start Chikitsa, the remaining topics in this class. So let's start with the Chardi Chikitsa. So it's a small chapter. The points you have to remember in this chapter is that the type of Shardi. Okay. So Acharya Charaga mentioned 5 type of Shardi. That is Vada, Pitta, Kapha, Sannipadaja and Dishtartha Yogaja. Okay, so you have to focus on the type. Mainly here, Dvishtartha Yogaja is the additional one, mainly the Acharya mentioned here. Okay, and then the Shardi Purvaruba, that all point you have to study. Okay, and the main points that you have to focus here is the Asatya Shardi Lakshana. Okay, here, Shonita Puya Yukta Shardi. That is, if the blood mixed shardi or vomiting is present, and vinmutayos that samavarna gandham. Okay, so these are the asadi shardi lakshana. Mainly you have to be point out. Okay, and coming to the shardi roga chigilsa, here the shardi is mainly amashyotklasho bhava. Okay, this originated from the amashya, and here mainly lenganam is the treatment Acharya mentioned. Okay, and except Vadaja Shardi, and the remaining Shardi, we have to do some Shodhana therapy. Okay, and also Hridya Dravya Prayoga can also we have to adopt in the Shardi Roga Chikitsa. Okay, then next point, that is the Dvishtaktaja Shardi Chikitsa. Here it is a 2-star important point. What is the treatment here we have to give to the patient? That is mano apikadetu mano anukula vajaha samashwasa harshanai. So mainly we have to give ashwasana. Okay, and the things which provide happiness to the mind of that patient, or that we should give the food according to the wish of that patient. Okay, that is the treatment mainly we have to adopt in the Dishtartha Samyoga Shardi. Okay, that is 2-star important point. And next is Dirgha Kalina Shardi Chikitsa. That means if the Shardi, the disease is chronic in nature, what is the Chikitsa we have to do? Mainly Vada Nashan. Because in the all disease which are chronic in nature, Vada Shamana or Vada is the predominant dosha in that case. So Vada Nashana treatment we have to give there. And Stambara therapy. Okay, Stambana should be given, and also Brahmana Chikitsa. So due to this chronicity of the disease, the patient become very weak. Okay, so that Brahmana Chikitsa we have to adopt it. So that is 2-star important point. Dirghakalina Shardi, we have to focus mainly Vada Shamanam and Brahmana therapy and also Stambhanam. Okay, and Sarpir Guda, Kalyanaga Gruda, Jivaniya Gruda, and Vrishya Yoga, Mamsarasa, Ayaleha Prayoga, all these are the yogas mentioned in the Shardi Yoga. Okay, and Sushrutacharya also mentioned the 5 type here. He mentioned Aganduja Shardi instead of Dishtarthaja Samyoga Shardi. Okay, that point you have to note here. And the point you have to remember here, the dosha dushti mainly present in the Shardi is Udanavada along with the Vyanavada. That is 2-star important point. This question can be asked. So in Shardi, the dosha predominance is Udanavada along with the Vyanavada. 2-star important. Okay. And next point you have to remember in this chapter is that in Vadaja Shardi, Lengana is Varjya. And all other Shardis we can do the Lengana except Vatiga Shardi. Okay, and Shardi mein bahudosha रहने पर Vamana Virechana Prayoga can be done according to the dosha. Okay, and we can also prescribe the Jwarekna Kashaya and Makshiga Shabad Prayoga. All these can be, we can advise here. And next, in Agantuja Shardi Chikitsa, that is, Acharya Shishruda mentioned Agantuja Shardi instead of Dishtartha Samyoga Shardi. Okay, so in Bivalsaja Shardi, this means Hridya Padartha Sevana is mentioned. So the treatment of the Agantuja Shardi is two-star important. Okay, and Daukruta Nimittaja Shardi means Ichhanusar Padartha Sevana. That you are already studied that point. And in Amaja Shardi, first treatment, that is Lankana should be done, and after that Vamana should be done. Okay, and in Krimija Shardi, Krimija Hridroga Chikitsa, very important. In Krimija Shardi, which treatment we have to adopt? Krimija Hridroga Chikitsa. Okay, so Krimija Shardi, Krimija Hridroga, very important point. Okay. Then, coming to the Ashtanga Hridaya's opinion, that is, he also mentioned the Dishtartha Yoga Shardi. And here the Shardi Purva Rupa is mentioned. So one star important to the Shardi Purva Rupa, that is Utklesha will be there. Asya Lavanyam and Prasegam Aruchi. So the Asya Lavanyam, that point you have to remember. So that is the Shardi Purva Rupa. Okay, Asya Lavanyam. Then coming to the Pittaja Shardi Lakshana, Sharodaka Nibam. So the Pittaja Shardi is similar to the Sharodaka. So that point is 2-star important. Okay. Then here Acharya mentioned that all Shardis are Amasya Utklesha Bhava, and if the Rogi is Balavan and the patient is always having this Shardi, then Vamana is the treatment. Okay. So we have already studied that in all Shardi, what is the first treatment that we have to do? Lankana, except Vadika Shardi. Okay. But according to the condition of the patient as well as the disease, we can say that if the disease and the patient is strong in nature, then Vamana can be given. Okay. And after that, Hridya, Madhya, Falambu or Kshira Saha Virejana is indicated. Okay, so Virejana is advised after the Vamana. The Virejana drugs can be used, that is along with the Kshira or Falambu or Madhya. Okay. Then in Ruksha Durbala Manushyame, then if the patient is Ruksha and weak in nature, then we can give Shamana Aushadha. Okay. So Shamana Aushadha is mainly we are giving to the patients because most of the people in this present era is very weak in nature. Okay. And next important point, that is a Patya in Shardi. The three words you have to remember, that is Parishushkam, Priyam, Satmyamannam. Okay, so mainly the Patya, or we have to select the drug also which are Parishushka in nature, and that is very Hridya, Priya, and Satmya Anna. Okay, Satmya Anna, and Lagu is also we have to select. And Acharya also mentioned we have to select the Sugandha Dravyas, or Snana is indicated in the Shardi as the Patya. And Mukta Matrasya Sahasa Muge Shidambu Sejanam. Very important quotation you have to remember here. Mukta Matrasya Sahasa Muge Shidambu Sejanam. Okay, so that is an Adravya Chikitsa in the Shardi. You have to remember it. Okay, that quotation is 2-star important. And in specifically in Vadika Shardi, we can give Hridaya Dravya, which are Ushna in nature. Okay, Kinjid Ushna Sarpi along with the Saindava can be given as Pana, and Sneha Virejana is the main treatment we have to advise here. And in Pittaja Shardi, Virejana can be done with Draksha, Ikshu or Trivat, or Tvilvaga Grida can be used for Virejana. And then Mrit Brishta Loshtra Prabhavam Sushidam Salilam Pibet. This is very important quotation. This can be asked in your examination. Okay, so in Pittaja Shardi, Mrit Brishta Loshtra Prabhavam Sushidam Salilam Pibet. So in which type of Shardi this Mrit Brishta Loshtra Prabhava Salila can be used? Okay, which is a Shardi, Pittaja Shardi. Okay, and the nature of water, which is Mrit Bishta Loshra Prabhavam, is very cool in nature. Okay, that is why it is indicated in Pittaja Shardi. And in Kabaja Shardi, mein, Vamana we can advise, and if the patient is very weak, we can advise Ubhavasa. Okay, and Bishtaja Shardi, Mana Anugula Ubachara can be advised, and in Krimaja Shardi, as we have studied, Krimaja Hridroga Chikitsa. And if due to the Shardi Prasanga, that means chronicity of this Shardi, then Dadukshaya will be already taken place in the body of that patient, and Vadakoba will be also occurred. And we have to give Vamana Adiyoga Chigilsa in that case. Okay. And Stambhana Brahmana Chigilsa that we have already discussed now. And these the yogas, Sarpir Guda, Kalyana Grida, Trivaniya Grida, all yogas can be given in the Shardi. Okay. So these are about the Shardi Chigilsa. And we have to move on the next chapter, that is Trishna. Even though the Trishna, the chapter is very small, this is very important chapter in the aspect of clinically and in entrance examination. Okay. So the type of Trishna, Acharya Charaka mentioned the type as 5 in number. Okay. So you have to focus that in Trishna, mainly Vada, Pitta, Amaja, Rasakshaya, Ubasargacha. These are the 5 types. Okay, so here Kabaja, Sannipadiga, these type are not mentioned. That is very important. There is a chance to be confusion here. So you have to mark it 2-star important. So Amaja, Rasakshaya, Ubasargacha. These are the 3 type along with the Vada Pitta. Okay, so here you can write the code, that is Amra Rasa. Amra Rasa Sarga. Krishna means Amra Rasa Sarga. So Amra means Ama, Rasakshayaja, Sarga means Ubasarga. Okay. So along with the Vada and Pitta is also present. Okay. And the dosha predominance of the Trishna, that is also very important. That is Pitta and Anila. That is the dosha predominant of the Trishna. Okay, and the Krishna Purvaruba is Muga Shosha, that you can guess that Purvaruba Muga Shosha, 1-star important. But the type is very important, as well as the dosha predominance of the Trishna Roga is very important. That is Pitta and Anila. Then what will be the Trishna Atmalinga? That is 3-star important, Sarvada Ambu Kamiko. Desire of the water is the Trishna Swalakshanam. 3-star important for that point. And you have to read the Trishna Samanya Lakshana, and here you have to focus Badirya as the Samanya Lakshana. Okay, and Jihva Nirgamana, and Talu Oshta Kanda Jihva Karkashana. These 3 points are very important as the Samanya Lakshana of the Trishna. Okay, and mainly in Amaja Trishna, आमा और पित्त से उत्पन्न होने से आग्नेय in nature. Okay, and Airuchi, Atmana, Kaba Prasega, these are the symptoms of Amaja Trishna. Then Rasakshaya Trishna, mainly Dina Swara, Tamaha, Hridaya Gala Talu Shushkada. These are the features of the Rasakshaya Trishna. And the important type of Trishna, that is Ubasargaja Trishna, it is mainly associated with as the complication of diseases like Jwara, Meha, Shaya, Shosha, Shwasa, etc. Okay, so in these diseases, whenever the complication is present, so it is always associated with the Trishna. So in that case, we have to treat the disease here first. Okay. So the Lakshana of the Ubasargaja Trishna is Pidam Pidam Hi Jalam Shoshayas Tavado Nayadisham. Even though we are taking enough water, we will not get subside with this Trishna. Okay, that is Ubasargaja Trishna. 3-star important to that type of Trishna. And coming to the Trishna Roga Chigilsa, mainly Krishna means Indra Jala Prayoga. and Nasya Prayoga is indicated. So Vada Pitta is the predominant dosha. So we have to adopt Vada Pitta Hara treatment, and also Aindra Jala Prayoga is mainly advised in Trishna Chikitsa. That point is important. And in the Trishna Chikitsa context, Shridha Shida Jalapanam. Okay. In which condition we can use the boil and cool water? That is in Sannipada Janya Vyadhi name. Shridha Shida Jala can be used. That point you have to note as a 2-star important point. Okay. So in Sannipada Vyadhi, Shridha Shida Jala can be used. Okay. And in which condition we can use the Ushna Jala? That is Hikka, Shwasam, Navajwaram, Peenasam, and also Galarogam, Kabhavadaja Vyadhi. Okay. More commonly, Kabhavadaja Vyadhi and Sadhya Shuddha Vyakti. We can use the Ushna Jala. Okay. Then, next, the type of Sushrudha Acharya mentioned about the Trishna. So Charaka mentioned 5 types, whereas the Sushrudacharya mentioned 7 in number. That is Vada, Pitta, Kabaja, Shada, Shaya, Amaja, Bhakta, Nimittaja. Okay, so these are the 7 type of Trishna according to Sushrudacharya. You have to study the number and type also. We have already discussed the code for it in our recorded classes. And here you have to mainly focus the Shaya Trishna Lakshana. The Shaya Trishna is mainly occurred due to the Rasadi Dadukshayam. It is mainly occurred due to the Rasadi Dadukshayam. And the another name for this Trishna is Sannipadigi Trishna. Okay. So that point 2-star important. So which Trishna is known as Sannipadigi Trishna? Shayadi Trishna according to Sushrudacharya. Okay. And what about the Bhakta Trishna? Bhakta Nimittaja. That is the intake of Snigdha, Amla, Levana, Gulu, Anna. The Adhika Sevan होने पर this Trishna होता है और it is asadhya in nature. Okay. And Acharya Sushruta mentioned that in Trishna, Vamana can be given as a treatment, and Vamana is contraindicated in Shayaja Trishna. Okay, and also Pittakna Chikitsa is advised here, and all the drugs we can use, that is Jarokta Pajana Dravya, that also adopted in the Trishna Chikitsa. Okay, and that points, that is Jarokta Pajana Dravya can be used, and Pittakna Chikitsa mainly we can advise here, and Vamana is also advised, and this Vamana is contraindicated in Shayaja Trishna. Okay. So these points are mentioned in the Sushruta Samhita. And next to the Ashtanga Hridaya, that is Acharya mentioned the 6 type. Okay, so Sushruta mentioned 7, Charaga 5, and Vakpada mentioned 6. So 5, 6, 7 is the type mentioned to the Trishna type. Okay, according to Charaga, Vakpada, and Sushruta. And Trishna Adhishtana. That is 1-star important point. So Adhishtana of the Trishna is mainly Jihva Moolam, Galam, Kloma, Talu, and Toya Vahasira. Okay. That is 1-star important point. Toya Vahasira, Talu, Kloma, and Jihva Galam. All these are the Adhishtana for the Trishna. And coming to the Trishna Chikitsa here, Vada Pitta Hara Chikitsa is mainly we have to adopt, and Bahya Anda Shida Chikitsa, and Shamana and Shodra Chikitsa. So these are the Samanya Chikitsa Sutra for the Trishna. Okay, Vada Pitta and Bahya Anda Shida Chikitsa. That is very important treatment aspect. We can advise the patients who are coming in our OPD. Okay, especially if Ubas are just Trishnas, we that type of Trishna is mainly we are going to treat. Okay. Then these type of Trishna, that is Doshaja, Amada Trishna, and Shramajanya Trishna, you have to read that points. Okay, that is only 1 star important. Anyway, um, we have to study, that is Rogopasargaja Trishna Chikitsa. That is important. That is Dhanyambu along with the Siddha can be advised in the Upasargaja Trishna. Okay, and also Anya Sabi Chikitsa Mula Rogyansa. So mainly we have to give Dhanyambu along with the Siddha and Madhu, and also other treatment have to be planned according to the disease. Okay, if the Krishna is forced due to the Jwara, we have to treat the Jwara. Okay, along with the Krishna Chikitsa. Okay, that's all about the Krishna Chikitsa. So mainly focus on the type of Trishna and its name, and what are the Chikitsas. Mainly we have to give for the Samanya Trishna Chikitsa, and also Upasargada Trishna Chikitsa is important here. Okay, so that is the main points in the Shardi and Trishna Chikitsa. And now we have to move on the next chapter. Okay. Next disease, that is Kushta Roga. You know that Kushta Chikitsa is very important Chikitsa in Kaya Chikitsa. Okay. So this is a vast chapter. So we have to select the important points in this chapter. So it is not possible to study the all points in this chapter. So mainly the points you have to remember is Sapta Dravyas for Kushta. That is important. Okay. Sapta Dravyas for Kushta is important. Mainly, what are the Sapta Dravyas? 3 doshas along with the 4 dusha. So what are the 4 dusha for Kushta? Rekta, Mamsa, Twak, Lesika. Okay. Rekta, Mamsa, Twak, Lesika. These are the 4 dusha. So you can write the code for it. That is Rema, Rema तो लेसिगा पीकर पुष्ट हो गए. Okay. रेमा को लेसिगा पी लेसी. Okay. लेसी पीकर पुष्ट हो गया. So Rema here means therefore Rekta, Mamsa and Twak, and Lesi here means Lesiga. That are the Dusha, 4 type of Dusha for the Kushta. So totally Sapta Dravya for Kushta. These are important. Then next is the Purva Ruba of the Kushta. So what are the Purva Ruba? So Parushyam. Okay. There may be dryness of the skin. Agasmat Roma Harsham. So you have to mark that point. Agasmat Roma Harsham. And Sweda Bahulya or Asweda. Sometimes sweat is absent. Sometimes there is an increased sweat. There is a chance of increased sweating in the body. That is the Purvaruba of Kushta. That point you have to remember. That is Sweda Bahulya or Asweda. Okay, and Anga Supti. Sometimes the numbness can be associated, and Kandu is also present as the Kushta Purvaruba. Okay, so mainly Kushta Purvarubam, Lomaharsha, Asweda or Adisweda, and Kandu. Then, coming to the type, you are very familiar with the type of Kushta. I know that. So, what is the total number of Kushta? 18. 18 in number. Okay, so mainly Mahakushta is 7 in number, and 11 type of Shudra Kushta is also present. Okay. So 7 Mahakushta, 11 Shudra Kushta. So totally 18 is the number of Kushta. This Saptavidam, Ashta, Dashavidam, and Abharisangheyo Bhavati. Charagajari is mentioned that 8, 7, 18, and Asankhya as the number of Kushta. Okay. Then Next is the type. We have to study the what are the Mahakushta and what are the Shudra Kushta and the dosha predominance also. That is 3-star important. You have to study the dosha predominance of all the opinion of all these 3 acharyas, along with the Mahakushta and also Shudra Kushta. 3-star important. The questions can be asked any part from this portion. Okay. So first point about the Charagacharya. Almost Charaga and Vakpada mention almost the same dosha predominance in the Mahakushta. Okay. So Kabala Kushta is mainly due to Vada dosha. And Udumbara due to the Pitta dosha. And Mandala Kushta is Kabacha. And Rishijihva due to Vada Pitta. And Sidma Vada Kabacha. Okay. Sidma mentioned in the Charaga Samhita as the Mahakushta. Whereas Ashtanga Hridaya mentioned Dadru, that is Pitta Kabacha in the dosha predominance instead of Sigma. Okay, that point you have to mainly focus. That is in Charaga Samhita, Sigma is mentioned and in the Mahakushta, whereas instead of Sigma, Ashtanga Hridaya mentioned Dadru. Okay. So Dadru is Pitta Kaba in the dosha predominance. Okay. Whereas in the Sushruta Acharya mentioned that Vada dosha predominance is known as Arunam. Okay. Pitta as the Udumbaram and Rishijukva, Kabala and Kaganaga. These are mentioned as the Pitta predominant Pushta. Okay. And what about the Kabacha predominant? That is Pundariga and Dadru. Okay. So once again, I will repeat. Vadena Arunam. Okay. This classification is very, very important. That is why I am repeating Vadena Arunam. And Pitta predominant is Udumbaram, Rishijipva, Kabalam, and Kaganagam. And what about the Kabacha predominant? That is Pundariga and Dadru. Okay. This is the opinion of Sushrutacharya. Then, what about the Shudra Kushta? So, Shudra Kushta mainly the dosha predominance. Sushrutacharya mentioned that Parisarpa, Vadiga is Parisarpa. So you can write the code as Parisarpa whenever the word ending in letter A, that is Vada predominant. Parisarpa. Okay, this is by Sushruta. And Paitiga predominant Shudra Kushtas are Vicharchiga, Kidiba, Pama, Visarpa, Charmadana. Okay. Vicharchiga, Kidiba, Pama, Visarpa, and Charmadana. And what about the Kabacha predominant Shudra Kushtas? They are Mahakushta, Stularus, Ega Kushta, Sigma, and Regasa. Okay, so this is a classification given by Sushrutacharya. Next, according to Charaga and Vakbada, the Shudra Kushtas are Pitta Kaba predominant. Okay. Pitta Kaba predominant Shudra Kushtas are Shadaru, Dadru, Pama, Charmadala, and Visvoda. Whereas the Vada Kaba predominant are Alasagam, Vipadiga, Ega Kushta, Kidiba, Charma Kushta, and Vicharchiga. Okay, so Vicharchiga is mainly Kabaja. So you can write here Vicharchigu. Okay, that is Kabaja. Then we have to study the detailed lakshanas of the Mahakushta. So here I am only describe the important lakshanas. So first one, that is Kabala Kushta. So the points you have to remember is Alpakandu and Toda Artyam, that is pain is severe in nature, and Shikra Sarpi. Okay, that is it will easily spread. Shikra Sarpi. That is Kabala. Okay. Shikra Sarpi, Todhatyam, and Alpakandu. These points you have to remember. And next is Udumbara Kushtam. Here, Ashugadi is present. Okay, Ashugadi is present, and Krimi is present, Kandu is present along with the Pakwa Udumbara Phala Varnani. So its color is Pakwa Udumbara Phala Samana. Okay, so you can remember Udumbara Kushta, Pakwa Udumbara Phala Samana. So in that Phala, Krimi, there is a chance of occurring the Krimi, and due to that Krimi, Kandu will be there. Okay, you can remember like this. And next Kushta, that is Mandala Kushta. Here, in Mandala Kushta, Shukla Rektava Basini, very important symptom, Shukla Rektava Basini, and Bahu Kandu. The itching is severe in Mandala Kushta. Bahu Kandu and Krimi is also present. Okay, Bahu Kandu, Krimi is also present. And what about the Rishi Jifwa? So, Bahir Parusha Aruna Varnani. So, in Rishi Jifwa, you can take as the Jihwa, the tongue of an animal. Okay, so here Bahi Parusha Aruna Varna, whereas Anta Shyava. That feature you have to remember. Rishi Jihwa, Bahir Parusha Aruna Anda Shyava. And it is also Ashugadi and Alpakandu in nature. Okay, so which is Bahukandu Mandala. Alpakandu is Rishijihva. And Karkasha Bahukrimi Vidagajida is also the features of this Rishijihva. It is Karkasha and Bahukrimi Vidagajida. Okay, and next type, that is Pundariga Kushtam. Here Shukla Rektava Basini. Okay, and Rekta Raji is present. So the feature of the Pundariga Kushta is Shukla Rektava Basini and Rekta Raji. So whereas in Mandala Kushta, Shukla Rektava Basini, the same symptom is present, but Shukla Ramaraji is present. Okay, whereas in the Pundariga, there is Rekta Raji. Okay, and in Sigma Kushta, next type, Alpakandu is present, and Alabu Pushpa Sangashani, very important features in for the Sidma Kushta. So according to Charagajarya, it is like Alabu Pushpa Sangasha. Okay, whereas it is also mentioned at Daudiga Pushpavat. Okay, so its feature is mentioned as Daudiga Pushpavat. So Alabu Pushpa Sangashani and Daudiga Pushpavat. These are the features of Sidma. Okay, and the last type of the Mahakushta, Kaganandigam. So here the Sarva Kushtalinga is present, and the feature is that first it will have Rekta Varna, then it will turn into Krishna Varna, then Anega Varna. So that is the important features of the Kaganandiga Kushta. Okay. So according to Charagajarya, except this Kaganaga Kushta, all other are Satyam. Okay, all Mahakushtas are Satyam except Kagana. Then we have to learn the Shudra Kushta Lakshanas. Okay, so the Stula Arushi. First one, that is Stula Arushi. Here, Stulani Sandishu Adi Darunani Arushi. So Adi Daruna Stula Arushi is present on the Sandis. That is Stula Arushi. And Mahakushta, that is the type of Shudra Kushta. Okay, Mahakushta is a type of Shudra Kushta. The features are Twak Bedanam. In Mahakushta, Bedana of the skin is present along with the Swapna Angasap. Okay, so numbness is also present. And Ega Kushtam, Asvedanam, Mahavastu, Malsya Shagalobamam. Very important. 2-star important to the Ega Kushta symptoms. So, Ega Kushta. So, Mahan Ega Malsya. You can write a code for it. Mahan Ega Malsya. So, that is Mahavastu, Ega Kushta, Malsya Shagalobam. Okay. And Charma Kushtam. That is Hasti Charmavat. That is the important features of the Charma Kushta. So Hasti Charma, Charma Kushta, Hasti Charmavat. And next is Charmadala. In Charmadala, the point you have to focus is Sparsha Asaha. The Charmadala Kushta is Sparsha Asaha. Okay. Then Visarpa. Visarpa is the Shudra Kushta. Here, if the Pidaga and Shrava are slowly, then it is known as Parisarpa. That is Visarpaha, Shanehi, Parisarpaha. Okay. And next point, that is Sigma. Acharya Vakbada mentioned the Sigma under Shudra Kushta. Okay. So that symptom is very important. That is Bahir Ruksham, Antasnigdam, Krishtam Dajaha Gide. Okay. And Daudiga Pushpavat. So the Daudiga Pushpavat is the feature mentioned in the Ashtanga Hridaya, whereas Alabu Pushpa Sangasham is the feature mentioned in the Charaga Samhita. Okay, and it's Bahir Ruksham Andaha Snigdam. You can see that we are most probably we are correlate the sigma as the psoriasis. Okay, plague psoriasis and Grishtam Rajaha Munchil. That is also the features of the psoriasis. Okay, so sigma is very important. You have to study it with a 3-star rating. Okay, so Alabo Pushpa Sangasham and Dauda Daudiga Pushpa. These two features you have to remember. And next one, that is Vicharchiga. The point here, Lesigadya Vicharchiga. Okay, Lesigadya Vicharchiga. So church means Lesi Vicharchiga. Okay, Vicharchiga that you can take here as church. Church means Lesi, Lesigadya Vicharchiga. So here severe itching is present. And what about Vibhatika? So we can relate the Vibhatika as the crack food. Okay. So Kandu will be there. Adidaha, burning sensation. Ruja in Pada, Pani. Also this Vibhatika can be occur either in the Pada or in the Pani. Okay. So there may be Adidaham, Rujam or Kandu. Anyway, Pani Pada Spudanam, Tibra Vedanam is a feature mentioned in Charaga Samhita. And Tivrarti Manda Kandu. So, along with the pain, slightly the itching is also present according to Vakbadacharya. Okay. And Kidibam. Here Ugra Kandu is present and Shyava Kidagara Sparsham, Parusham, Kidibam Smrudam. That is very, very important. 3-star important. Okay. Shyava Kidagara Sparsham, Parusham, Kidibam Smrudam. We have to study. Okay. And next important point about the Regasa. Regasa is Sravahina. Okay. Regasa is Sravahina. And Dadru. Dadru Kushta is Durvavat. Okay. And Anushankini. Very important. In Vakpada mentioned the Dadru as Anushankini. And it is similar to Durva. Okay. Durvavat or Anushankini for Dadru. And Shadaru is having Stula Mula and Shadaru Syat Bahuvran. Okay. Shadaru Syat Bahuvran. So these are about the Shudra Kushta's features. And next we have to learn about the Kilasa or Shitra. The Kilasa or Shitra we can relate as a leukoderma here. Okay, mainly it is 3 types. Shitra is 3 in number, Vata, Pitta, Kaba. Okay, Uttarottaram, Guru. Okay, so the Shitram is take place only in Twak. Okay, and it is Aparisravi nature. So that is the difference between Pushta and Shitra. So the Shitra is localized in the Twak and it is Aparisravi. And what about the Vadiga Shitra? It is Paridvamsi, that means hair loss is present and it is Rektashrita. So it is otherwise known as Darunam. Okay, so Vadiga is Darunam, Paitiga is Charunam, Kabaja is Shitra. Darunam, Charunam, Shitra. Okay, and the Vadiga is Rektashrita, Paitika is Mamsashridam and Kabaja is Medvashridam. So you have to study. Trees are important about the type of Shitra. Vadam, Pittam, Kamam, Darunam, Charunam, Shitram, and Rektashridam, Mamsashridam, Medasashridam. And it is Rektashrida is Rektavarna, Mamsashridam is Tamravarna, and Medvashridam is Shvetavarna. Okay. So these four you have to study with 3-star important. And what about the treatment of this Shitra? Mainly, Shamsanam is the prime treatment we have to give in the Shitra. So, Shamsanam with the Malayu Rasa along with the Buddha is mentioned. Malayu Rasam with Buddha. Okay. And after the 3 days of Shodhana, this Malayu Rasa Kwada can be given for 15 days. So, Malayu Rasa is the main drug used for Shamsana as well as it can be taken internally as Kwada. Okay. And Varishta Lebana for the Shitra. Very important. Varishta Lebana for the Shitra Chikitsa is Madanga Charma Basma along with the Thailam. Okay. Madanga Charma Basma along with the Thailam is the Varishta Lebana. And Avalguja Bijadi Lebam that should be taken in the Gomutra. That is Savarnagaram Param. Okay, now these 2 points, that is, which is the Savarnagaram Param, Avalguja Bijadi Lebam with the Gomutram, and which is the Varishta Lebana, Madanga Charma Basmam with the Thailam. Okay, so don't forget these 2 points as the treatment of the Shitra. And Acharya also mentioned a quotation for the Shitra, that is Yededa Deepte Yeda Bhavani, that is indicated for Shitra Chikitsa. Yededa Deepte Yeda Bhavani. Okay, please note this quotation, very important. Yededa Deepte Yeda Bhavani is for Shitra. Okay, and the Chitrakasavam or Gomutrasavam is the main yoga we can advise to the patients in the Shitra. Okay. And then Chikitsa Sutra of the Kushta. Mainly, the shloka starts with Pushtinam Sneha Panena Purvam Sarva Ubhajani. Mainly, we have to give Sneha Pana is the first treatment. Okay. And Vadika Kushta Sarpi is mainly indicated, and in Paitika Kushta Rektamosha, and whereas in Kabacha Vamana is indicated. So 3-star important to this treatment principle. You have to remember it. Okay. Pushtinam Snehapanena Purvam Sarvam Bhajanet Vadigam Sarpi Paitigam Nektamosham, and again Kabacham is Vamanam. Okay. And if Alpa Kushta is present, then we can do Prachana. Okay. Whereas in Mahadi Kushta, Siraveda. Okay. And in Stira Kadina Mandala Kushta, mean Nadi Svedana can be given first, then after Purcher Vigadanam is done. Okay, first Nadi Svedhanam, then Purcher Vigadanam, and after the Mamsa Podali, which is made of Anuba Mamsa. Okay, Anuba Varija Mamsa Podali can be placed over that area, and after that Vilekana Karma is done with a Tikshna Shastram. Okay, and Alabu, Shringam or Jaluga can be used. So this is the treatment principle for Stira Kadina Mandala Kushta. Okay, first Nadi Svedam, then Purshan Vigadanam, then Potali, and along with the Vilegana with the Tikshna Shastram, and Shringa, Alabu, Jaloga, and last Lebana should be done. Okay, and what we will do if the Shastra Mokshanam is contraindicated and it is associated with the Sparshajnanam. So if the Shastra Mokshana is contraindicated and the patient is having numbness, then we can give Shara Karma. Okay, 2-star important. Then we have to give Shara Karma in Pushta. And Adhikatina Parusha Supta Stira Purana Pushta mean Agada Pana Agada Leba is indicated. Okay, Adhikatina Parusha Supta Stira Pushta mean Agada Pana Lebana is indicated. Okay. Then we have to study the different yogas mentioned here. Pili Padola Muladi Churnam. Okay, you may be hear this yoga, Padola Muladi Churnam. The quantity or the total dosage for the Padola Muladi Churna is 1 pala. Okay, 1 pala, and it should be used for Shadratra. Okay, 6 days. It is mainly indicated to use for 6 days. Padola Muladi Churna. Okay. And next is Gandhaka Basma or Lelidagi Vasa. Very important. Lelidagi or Gandhaha. Gandhaka plays very important role in the curing Kushta. And Swarna Makshiga, also Shila Jadu. These are the Rasabasmas indicated in Kushta Chikitsa. What are the Gandhaga, Swarna Makshiga, and Shila Jadu? Okay, don't forget these 3 Rasabasmas. And Acharya Vakbada mentioned Vajragam, Mahavajragam Gritam. Okay, so this Vajraga Grita is a Saptadasha Kushtam. It will helps to relieve from Saptadasha Kushta. Okay, and next important yoga, that is Mani Bhadragulam. This is a common yoga that we are advising the patients coming into an OPD. Mani Bhadram. It's very effective yoga. Okay, so it should be used for 1 month. This mainly indicator used for 1 month, and the Shottamadi Gridha is also advised here. And Sapta Samaguliga. Okay, Sapta Samaguliga, that is used as Rasayana. And what are the Rasayana Prayoga in Kushta? Very important, 3-star important as point in the Kushta Chikitsa. Rasayana Prayoga, that is Rasaya Prayogena, Tuvarastini, Belladagam, Bakuchi, Vandimulam, Shilahvayam. Very important. So this is mentioned in the Ashtanga Hridaya. I will repeat the point, that is Tuvarasti, Balladagam, Bakuchi, Vandimulam, Shilahvayam. So these are the Rasayana yogas mentioned here. Okay. Then Kanaga Bindu Arishtam. This question can be asked. That is the Kanaga Bindu Arishtam is indicated. That is Masena Mahakushtam Handi Alpam tu Pakshena. Okay. So this should be taken in the morning. This Kanaga Bindu Arishta should be taken in the morning. It should be used for 15 days in the Alpa Kushta, and in Mahakushta it should be used for 1 month. This can be asked. 3-star important for the indication of this Kanaga Bindu Arishtam. I think this is the only type of Arishta mentioned in the Kushta Chikitsa. And Patya in Kushta is mainly Tikta Shaga is indicated, and Lagu Anna should be taken by the patient. Okay. And Siddharthaka Snana, very important yoga. This Siddharthaka Snana is indicated. The ingredients of Siddharthaka Snana, you have to note that. Okay. It was asked in the entrance examination 2 to 3 years back. Siddharthaka Snana ingredient. Okay. So Musta, Tripala, Madana, Karancha, Arakvada, Darvi, Saptaparna, and Kalinka. These are the ingredients of the Siddharthaka Snana. Okay. And next is Gugulu Manijadi Thailam is indicated. That is Kushtam, Grishtajam, Nashtajam as the indication for the Gugulu Manijadi Thailam. This is indicated when severe itching is present in the Kushta. Okay. And next is Mahagedira Grudam. So this is indicated as the Param Kushta Vigaranu. Mahagedira Grudam is the indicated as Param Kushta Vigaranu. 2-star important. And next point, that is for Abhyanga, we can use Vajraga Taila in Kushtarogi. And for Ulsadanartham, Aragvadadi Kashayam. For Pana Parishega Avagaha, we can use Gadirakvada. So this is mentioned in Sushra Samhita. 3-star important to this point. So Gadira is known as the single drug for Kushta. You know that. So it can be used for Pana, Parishega, Avagaha, all these purpose. Gadirakvada. Okay. And for Abhyanga, Vajragathaila. And for Ulsadana, Aragvadadi Kashaya. Okay. So don't forget that. And Sarvesham Tuvaragam Belladakam. Okay. Sarvesha Tuvaragam, and Belladagam. Very important. And Gajalinda. Gajalinda is indicated in Shitra. Okay, Gajalinda is indicated in Shitra. And Acharya mentioned Ayaskruti Vidhi in the Mahakushta Chikitsa. And the importance of Shodhana in Kushta, that is very, very important. That is Vamana in Kushta Rogi, that should be done in every 15 days. Okay. And Virejana in every month. And Nasya should be repeated in every third day. And Ektamokshana in every 6 months. Okay. This is 3-star important. One question can be asked from this part. Okay. So Ektamokshana in every 6 months. And in every month, Virejana. In every 15 days, Vamana. And in every third day, Nasya. Very, very important. Okay. So these are about the Kushta Chikitsa. Okay. So Kushta Chikitsa is very important. And next we have to move to the next chapter, that is Hikka and Shasa. Okay. So mainly in Hikka and Shasa, it is 5 in number. Okay. Hikka and Shasa, they are 5 in number. So Hikka, that is Mahahikka, Gambira Hikka, Vyapeda, Shuddha Hikka, and Annaja Hikka. So you have to remember the name and type, okay, of this Hikka and Shwasa. And Mahashwasa, Urdhva Shwasa, Chinna, Tamaga, Shuddha Shwasa, these are the type of Shwasa Pragara. You are already know that. So I will not go in detail about these names, okay. And in Hikka Shwasa, in Dono Vyadhi में Kaba Vada Pradana. Dosha predominance of these diseases are Kaba and Vada. Very important, these are important. And they are Pitta Sthana se Ulpanna. Okay. Even though they are originated from the Pitta Sthana, mainly they are Kaba Vada predominant. And Param Durjayam. These two diseases are known as Param Durjayam. Very, very important. Okay. And here, the Srodhas involved are Prana, Udaga, Annavahini. Okay, so you can write the code as Uba, 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 Hikka, Shwasa. That is Udaga, Prana, and Annavahini. Srodhas are involved, very important. And next point, that is that's about the Shwasa Nidhana. Okay, so first we have to study about the Shwasa. Shwasa, the Nidhana of Shwasa mainly the Amadisara, Vamadu, Visham, Pandu, Jwaram, Rajodumanilam, Marman Abhigadam, or Adihima Ambu Sevanam. These are known as the Swasa Vidhanas. And the Purvarupa, mainly you have to know that Prana Vilomada. Okay, Prana Vilomada can be seen in the Purvarupa of the Swasa and Anga Beda. Okay, Anga Beda. Then we know that Shwasam is Amashya Samudbhavam. Okay. And Vaktra Vairasyam. The point here, the Purvarupa, we have discussed that Prana Vilomada can be seen along with the Angabeda. Whereas in Madhavadidana, Acharya mentioned the Purvarupa, Vaktra Vairasyam, very important. So here, Vaktra Vairasyam is present as the Purvarupa of the Shwasa. Okay, note that Vaktra Vairasyam. This can be asked. So Vaktra Vairasyam is the Purvarupa of the Shwasa. Okay. Then we have to start with the Shudra Shasam. So Shudra Shasam is mainly produced due to the ayasa. Okay. Tatra ayasad adibojana. Swayam samshamanam. So these are mainly caused due to the intake of heavy food or ayasa, and it will relieve by itself. Okay, that is Swayam samshamanam is the feature of Shudra Shwasam. Okay, Shudra Shwasam, and it is mainly Vadadika in nature. Okay, so what are the points you have to remember about the Shudra Shwasam? They are Swayam samshamanam, and mainly due to Adi Bojana and Ayasa. Okay. And whereas Tamaga is very important. Tamaga is mentioned as Vada Kaba predominant. Okay, Tamaga Shwasa is Vada Kaba predominant, but Madhava Acharya mentioned as Kabaja only. Okay. Madhava Acharya mentioned it as Kabaja only, but all other Acharyas mentioned Vada Kaba, Tamagei. Okay, you can write the code as Tamagai. But if the question is asked according to Madhavacharya, the Tamaga dosha predominance is Kabacha. Okay. And the symptoms you have to remember here is Tivra Vegam. Okay, Tivra Vegam and Prithra Shrasadi. And also the Karodi Penasam, Tena Rudo, Gurburagam Tada. Okay, so the sound that is Gurguraga Ruddha can be heard, and Adiva Tivra Vegam Swasam Prana Prabhidagam. Okay, and mainly the point that is vimoksha tasyeva vimokshanti muhurtam labade sudam. So whenever the mucus is expelled out, then the patient get relieved from that tamagashwasa for a while. Okay, and Nacha abhinidram lebade shayanaha shwasapinda. So he will not get good sleep when he is in the lying position. Okay. Asino lebade saukyam. Ushnam cheva abhinandadi. Very important features of the Tamaga Shwasa. Okay. So he will get relieved from all symptoms when he is in the sitting posture. And also he is always desired to have to take the hot things. Okay. Ushnam cheva abhinandadi. And Uchridaksho, Leladena Siddhyada, Risha Artiman. So these are the main features of Tamagashwasa. Really, Tasyeva Vimokshante Muhurtan Lebade Sugam. And next, Asino Lebade, Saukya Ushnam Cheva Binandadi. And Nacha Vidran Lebade Shayanaha Shwasa Pratida. Okay. And in Meghango Shida Pragvade, Shleshmalecha Vardade, Sayapya. So it get increased on Megha, Ambu, Shida Pragvadehi. These are the factors which increases the risk of Tamagashwasa. Okay. And those who intake the Shleshmala or Shleshmala Ahara, also there is increase of chance of getting Tamagashwasa. Okay. And mainly it is yapya in nature, but in balinaha, if the patient have bala, then it is satya. Patient is having bala, and if it is acute in nature, then it is satya. Otherwise, the tamaga shwasa is yapya. Okay, the prognosis of tamaga shwasa is important. So tamagaya, you can write the code is tamagaya, that is yapya in nature. But if the patient have strength and also Nava in nature, then it is Satya. Okay. Then if this if this Tamaga is with the Jwara and Murcha and it get released by Shida, then it is called Pratamaga. Okay. So Pratamaga Shwasa Jwara Murcha Paridasya Vityat Pratamagam Tutam. Okay. Ones are important to that point. And Tamasaha Vardade, Shide Shashu Prashamyade, that is Santamag. Okay, so that is the Santamag. Tamasaha Vardade, Shide Shashu Prashamyade, that is Santamag. Okay, so Tamagam, Pradamagam, Santamagam. Okay, don't forget. So Pradamagam associated with the Jwara Murcha and Santamaga is increases with the Tamas. Okay. So this point you have to remember, Tamaga Shwasa is very important. And next is Chinna Shwasa. So Chinna Shwasa is mainly Kabhavada Yukta. In Chinna Shwasa, Marma Cheda Ruja is present. So even though Shwasa is Chinna or small, but its pain is very severe. Marma Cheda Ruja is present. Okay. And Vasti Daha is present. And Mutra Nirodhan can be there. And Mukun Rektega Lojanam and Nashta Chaya is the features of the Chinna Shwasa. Okay. So Mukur Rektega Lojanam. That is important. Mukur Rektega Lojanam and Nashtachaya. Okay. And here in Chinna Shwasa, Viprodaksha is the features present. You have to mark it. And Sashikram Prajahatyasun. So there is a chance. So it is very asadya in nature. So the patient may be die due to this Chinna Shwasa. Okay. Then next is Mahashwasa. So Mahashwasa, the features are very important. The Mahashwasa, Uchehi Shwasadi. Okay. And Matta Rishabhaha Ivashinam. That feature is very important. Okay. So Mahadaha Nadena Shwasadi. That is Mahashwasa. There is a very loud sound can be heard and which is similar to Matta Rishabhaha. Okay. Matta Rishabhaha. Very important. Mahashwasa, Matta Rishabha. And Pranashta Jnana Vijnana Stada Vibranta Lojanaha. Okay. So that is an important feature. Pranashta Jnana Vijnana Vibranta Lojanaha. Okay. And also Baddha Mutra Varchaha can be seen. And Sa Shiprameva Vipathyade. Okay. So Mahashwasa, you have to remember it is like Matta Rishabhaha and Pranashta Jnana Vijnana and Vibranta Nayananaha and Vishirna Vak. All these are present. And what about the Urdhva Shwasa? Madhavendra mentioned it as a Vada predominant Shwasa. And Dirgam Urdham Shwasadi. In Urdhva Shwasa, Dirgam Shwasadi Urdham. Okay. And Adaha na Pratyaharadi. And here Urdhva Drik is present. And Marma Chintya Manishu Paridevi. All these are the features of the Urdhva Shwasa. So at least you have to study these points I have discussed now. Okay. So you don't have to study the whole shloka. If you are already studied this shloka, you can go with it. But mainly focus the features which is seen on the eyes. Vibranta Lojana can be seen Mahashwasa. And Urdhva Nayana can be seen Urdhva Shwasa. Viprodakshaha, very important in Chinna Shwasa. Okay. So these points you have to study with. Okay. Then we have to learn about the features of Hika. Okay. In Hika Purvaruba, that is Kanda Udo Guruttam can be seen. Okay. Kanda Udo Guruttam can be seen and Vadanasya Kashayada Tuksherada. That is the feature of the Hika Purvaruba. So in Shwasa Purvaruba, we have seen that Vadanasya that is we cannot identify which are the taste on the mouth. Okay, awairasya can be the feature of Shwasa. Whereas in Hika, Vadanasya Kashayada is the feature. Okay? So don't forget, these are important to the Purvaruba of the Hika and Shwasa. And coming to the Swarupa of Hika, Mukur Mukur Vayur Udedi, Yagat Prihandarani Kshiban. So this is the quotation from Madhava Nidana. Mukur Mukur Vayur Udedi, Yagat Prihandarak Shiban. Okay. And mainly it is 5 type, you know that. And the Annaja Hika, you can start with the Annaja Hika. It is mainly Satmya Annapanena Samam Yati. Okay. Bukte Shamam Yati. This is the feature of Annaja Hika. Okay. So it get relieved after the intake of the food. Bukte Shamam Yati. Whereas in Shuddha Hika, it is also from Ayas. It is mainly caused due to Ayasa and it is produced from Jatru Urdha Moolam. Which is produced from Jatru Urdha Moolam, Shuddha Hika. Okay. And Mukta Matre Mardavam Yati. That is a feature of Shuddha Hikka. Mukta Matre Mardavam Shuddha Hikka. Satmya Annapanena Samam, that is Annaja. And Yamala Hikka, that is important one, that is Ahara Parinama Unmukhe Parivrittade. Pariname Vriddhim Gachadi. So it is mainly produced at the time of Ahara Parinama. That is Yamala Hikka. And here Netra Vipruda, that is Viprudakshaha is present in the Yamala Hikka. Okay, that is very important. Viprudakshaha is present in the Chinna Shwasa as well as in the Yamala Hikka. Okay, and the synonyms mainly mentioned for the Yamala Hikka is Vegini and Parinamavadi. The synonyms of Vegini and Parinamavadi. Okay, so the synonym is very important. Vegini and Parinamavadi. And what about the Mahahidma? Here also Viprudaksha can be seen. Okay, and Smridim Sapnyam Nasha is occur here, and Annamargasya Rudandi, and Marma Gattanam, and Mahavegam, Mahabalam, Mahamulam is the features of Mahahidma. So there is Maha. So in Mahahidma, Mahamulam, Mahabalam, Mahavegam. Okay, so don't forget, it is easy to remember. And what about the Gambhira Hika? It is mainly produced from Pakvashya. Pakvashyadva, Nabirva. Okay. So these are the main features of the Hika. And also you have to focus one more point. That is Mahahika. Here it is Sadhya Pranahara. Okay. Mahahika is Sadhya Pranahara. Whereas the Gambhira Hika, that is Prana Andagi. Please note these words are very important. The questions can be asked like which is the Pranandagi Hika, that is Gambhira, which is Sadhya Pranahara, that is Mahahika. Okay. And Prana Ubarodini, that is Vyabheda Hika. Okay. Vyabheda and Shudra Hika, it is mainly produced by the Poshtat Vyayama, or these are the Vidhana for the Shudra Hika. And the Annaja Hika is mainly Sahasa Atyabahudehi, Pananehi, Pididana. So this type of Hika is mainly, we can see it is mainly occurring in our daily lives. Okay, Annaja Hika. And coming to the prognosis of the Hika, that is Annaja and Shudraja are Sadhya. Okay, the prognosis is three are important. Annaja Hika and Shudraja Hika is Sadhya in nature, whereas Mahan and Gambhira is Asadhya, and Sarvalingam Vegini is Varjali. Okay, Sarvalingam Vegini is Varjal. Okay, and what about the prognosis of Shwasa? Shudra Shwasa is Sadhya, whereas Tamaga is Kritra, and Chinna, Mahan and Urda, they are Tedehi Siddhe Avyakta, Vyakta, Pranahara Dhruvam. These are the things mainly mentioned for Chinna Mahanurda. These are Asati in nature, but it's Avyakta Avastha. Okay, but these diseases are not fully manifested, then they are Sadhya. Otherwise, they will kill the patients. Okay, that is Chinna Mahanurda. Okay, and Kamam Pranahare Shiva. This is the quotation mentioned for Shwasa and Hika. How this Kama will kill a person. Like this Shwasa and Hika will kill the person. Okay. And Durnivara, like Vajra. The diseases which are known as Durnivara, very difficulty to cure, like Vajra is Shwasa, Kasa, Vilambika. Okay. Swasa, Kasa, Vilambika, then Durnivara like Vajra. Okay, so these are the prognosis of the Hika and Shwasa. And we have to learn about the Chikitsa. Okay, Hika, Shwasa, Chikitsa. Mainly, in Shwasa, yet kinchit kabavadagnam, ushnam vadanulomanam. Okay. And in Shwasa Hika, mainly Svedana can be done, and then Vamana is indicated, and Dhumamana is indicated. Okay. So here you can see that Hikashwasardidam Snigderado Sweder Bajare Aktam Levana Tailena Nadi Prastarasan. So externally we can give the Taila along with the Levana can be used as Abhyaga, and after that Nadi Prastara Sangara Sweda can be used as a Sweda. Okay. And in Kabadikya Avastha में Vamana and Virechana can be used according to the condition, and we can use Vada Shleshma Hare Tamagetu Virechanam. Okay. We know that Tamaga Shwasa is Vada Kaba, predominant disease. So here Virechana can be administered. Okay. And if the Swarabanga is present, then Vada Kaba Nashaka Dravya can be used as um, Shardi. Okay. And next important point, that is Shara Prayoga. Very important. The Shara Prayoga in Shwasa and Hidma. Mayura Pada, Shallaga Shagalam. These can be used as the Shara Prayoga. Mayura Pada. Okay. And Kasine Shardanam Dadyat. Swarabedasha Buddhiman. Okay. If the Swarabeda is present, then Shardi can be given as a treatment. Okay. And Adravya Chikitsa. Next is in Hikka. In Hikka and also in Swasa, Adravya Chikitsa is mainly indicated. So what are the Adravya Chikitsas mentioned here? Shidambu Segaha, Trasana, Vismabana, Baya, and Kidehi Damshanam. Okay, Kidehi Damshanam. So this Adravya Chikitsa is very important. Kidehi Damshanam, Trasanam, Vismabanam. So all these things we can use in our daily clinics. Okay, as a Adravya Chikitsa can be adopted in Hikka. So it will be helpful to get relief the Hikka instantly. Okay, if you don't use this practically, you can use it. It is very useful. Adravya Chikitsa in Hikka. Okay, especially Trasanam and Chidambu Sejanam. Okay, Bayam. All these factors will very fastly cure the Hikka. And next here in Hikka, Hikasthana Svedana is indicated. Okay. And Avapida Nasya can be done. Virechana is Pathyatama. Very important. So which is Pathyatama Virechana. And for Nasya, we can use Leshuna, Palandu, Vrinchanagam, Gudam, Chandanam, Nari Kshiram, Makshigavik. All these can be used for the Nasya. Okay. So that drugs you have to mark with the 1-star important. Lashuna can be used. Nari Kshidam, Gudam, Chandanam, Vrinchanagam, Makshigam. Okay. So the yogas mainly mentioned here is Trushana Gridam, Jeevaniya Gridam. Okay. Dadiga Gridam, Vasha Gridam. And the main treatment principle, that is Kabavadagnam, Ushnam, Vadanulomana Beshajam, and Annapana Prayoga is indicated. Okay. And the yoga, that is Tejovatyadi Gridam, is very important. And Muktadya Churna, this is mainly indicated in Hikashwasa and Manashiladi Gridam. At least you have to remember the name of these yogas and the context where this yogas is mentioned. The Tejovatyadi is oftenly asking question. Mark it as 2-star important. Okay. So these are about the Shwasa Chikitsa, Shwasa and Hikka Chikitsa. Okay. Next, we have to start with the Kasa Chikitsa. So we know that the Kasa type is mainly 5 in number, Panchakasam, Vata, Pitta, Kapha, Shada, Shaja. Okay, so that Shada, Shaja, you have to remember here, there is no Sandi Pavika type mentioned in the Charaka Samhita. Okay, and the Kasa Purva Nubhume, you have to study Kante Kandu. Okay, so the itching on the Kanda is present and Bhojyanam Avarodhanam, very important feature, and Shuga Purna Galasyada. These are the Purvarupa of the Kasa. Okay, and coming to the type of the Kasa, really, the differentiation of the Kasa is really depending upon the Hedu Beda. Okay, Hedu Beda and Pradigata Beda. Here, the Vadika Kasa, the features you have to remember, Vadika Kasa is Swarakshaya and Shushka Kasa. Okay. So Vadika Kasa is mainly Shushka, dry cough. Okay, that is dry cough and Kafam Shushkam Krichan Mukta Alpadam Prachi. So there is, so the product, it is not a productive cough. So it is, the nature is Mahavegam. Okay. It is very Mahavegam in nature and Roma Harsha can be occur here. So in Vadika Kasa, you have to remember mainly that is dry cough and Mahavega. And next is Paitiga. So in Paitiga Kasa, Pradadam Kasa Vegam. So there is a cough is repeated. Okay, Pradadam Kasa Vegam. Repeated cough can be there. And also Pitta Asrat Vamana can be there. Okay, and this will leads to Jyodisha Darshanam. Okay, Jyodisha Darshanam. So Paitiga Kasa, Jyodisha Darshanam. That is important feature. So after the repeated cough, there is the patient will see a light. Okay, so Paitiga Kasa. That is the code. After the repeated cough, the patient is very fatigued and he may be see a different type of light. That is Jyodisha Darshanam. Very important. Then next is Kabacha Kasam. Here also Rama Harsha is present. Okay. And what about the Shaddaja and Shayaja? That is an important type of Kasa here. Sorry for the inconvenience. I am also having the cough. Okay. So here, Shaddaja Kasa, really, it is Vada Pittanubandha. Okay, Shaddaja Kasa is Vada Pittanubandha. So here, Shodida can be seen. And also, Paravada evacuation. These are the features of the Shaddaja Kasa. Okay. And next is the Shaya Kasa. It is mainly caused by Vata. Okay. And Pudi Puyobamam are the features of the Shayaja Kasam. And Hridayam Padadivacha. You have to mark Hridaya Padadivacha. So the features are very important. And another important features in the Ashtanga Hridaya is Srimad Darshana Netrada. So in Shaya, even though the person is having the Shayaja Kasa, his face is very beautiful. That is Srimad Darshana. Okay. So what are the features you have to remember in the Shadida Kasa? In the Shadaja Kasa, mainly Vada Pittani Bandham, and it is Shushka, Vedidam, and Shodidam. Okay. Whereas in the Kshayaja Kasa, Hridayam Padadivacha and Akasmat Ushna Shida and Srimad Darshana Netra. These features you have to remember. Okay. And in the Shayaja Kasa and Shadaja Kasa, that will cause uh, Shinanam Deha Nasham. That means it is asadhya in the person who is having Shina Deha. Okay. And for Belinaha, they are sadhya. The prognosis of Shadaja and Shayaja, if the patient is having Bela, then it is sadhya according to Charagacharya. But it is Yapya according to Ashtanga Hridaya. Okay. And this Vada, Pitta, Kaba, these cough are sadhya in nature. Samsargaja kasa is Yapya. Okay. And if the kasa is occurring in the Biovruta, then it is Sarva Yapya in nature. Okay. So I will repeat the prognosis. That is very important. So in Biovruta, the kasa is Yapya in nature, and the Kshaya and Shadaja kasa, if the patient is having Bala, then it is Yapya according to Ashtanga Hridaya, and it is Sadhya according to Charagacharya. Okay. Then that coming to the treatment aspect in Vadika Kasa, along with the Pitta, then Urdha Bhaktiga Gridam or Shiram is indicated. Okay. One star important to the point, that is Vada Kasa with the Pitta, then Urdha Bhaktiga Grida or Shira is indicated. And when the Vada Vadakasa with Kaba, Sneha Virejana is indicated. Okay. And if Baddha with Vada, okay, then if the condition where the Baddha with is present, then Vasti is indicated. Okay. Vasti is indicated. Then the Rasayana Vidhi of Pippali is mainly mentioned in the Kasa and Udakshada. Then, which is the Rasayana Pippali. Pippali Rasayana is indicated. And here, Kandagadi Gridam, Dasna Dashamula Gridam, very important. In Dasna Dashamula Gridam, Aja Mamsa Rasa is added. Okay, so the indication of the Dasna Dashamula Gridam is very important. That is mainly Panjagasam Shayam. All these are indication for this Dasna Dashamula Gridam. Okay, then coming to the Dhumapana, here in Kasa, Nasa Sravam and Shirapedanam, Pradittamyadi, Pradishaya. In this condition, we can give the Dhupanam. And here, Snehika Dhuma can be used by the Ashtanga Hridaya. Okay, whereas Vairajnika Dhuma is indicated by Charakacharya. One star important to the point of Dhuma, Vairajnika Dhuma by used by Charakacharya. Okay, whereas Snehika by Ashtanga Hridaya. And the point with three-star important point in the Pitta Kasa treatment, that that is the important part in the Kasa. Okay. If you don't have any time to study these all points, at least you have to study the Pitta Kasa treatment. Okay. That is very important. Pitta Kasa treatment. That is the Pitta Kase Sakabe. Vamana is indicated. Okay. Pitta Kase Sakabe. Vamana is indicated. And Pitta Kase with the Tanuk Kabe. Okay. The Pitta Kasa along with the Tanuk Kaba. Okay. The Kaba is Tanu in nature. Then Trivrit with the Madhura Dravya. Okay. Trivrit with the Madhura Dravya Videchana is indicated. Very, very important. In Tanuk Kaba, Trivrit. Okay. In Pitta Kase with the Ganak Kaba, then if the thickness of the mucus is increased, then Trivrit with the Tiktaka Dravya can be used. Okay. So in Tanukaba, we can use Trivrit with the Madhura. Okay, Madhura Dravya. Whereas in Ganakaba, Trivrit with the Tiktaka Dravyam is used. Okay. So please note the Dravyas. That is Madhura Dravya is used in Tanukaba, whereas Tikta Dravya is in the Ganakaba. whereas the Trivrit is common in both these both. Okay. So that treatment you have to focus very, very important. Okay. Next, in Kasa, where the Anubandha dosha is seen, then we have to give the treatment for the Anubandha dosha first. Okay. And next about the Shadaja Kasa treatment. In uh, Shadaja Kasa, we can give Pitta Kasa treatment. Okay. In Shadaja Kasa, Pitta Kasa treatment can be given. Okay, sorry for the inconvenience. And next is the important treatment principle in the Kasa Chikitsa, that is Brahmanani Vibanam. Atmishya Srodhasamcha Vishodhanam. Vityasat Shaya Kasibhyo. Balyam Sarvam Prashisya. The Vityasa Chikitsa is mainly indicated for this Shadaja Kasa. Okay. So Vityasa Chikitsa is mainly indicated for Shadaja Kasa. That at least you have to remember this point. And also Brahmana Vibana Chikitsa. Okay, this treatment can be given differently according to different time. This is the main treatment of Shadaja Kasa. Okay, so these are the important point about the Kasa. Mainly you have to focus on the Pitta Kasa treatment, and in Shadaja Kasa, Pitta Kasa treatment also adopted, and Kabaja Kasa along with the Pitta Nibandha, we have to do the Pitta Kasa Chikitsa. Okay, so these are about the Kasa Chikitsa, and here you have to focus on the important points only. So Kaya Chikitsa, we know that it is a vast subject. So mainly focus the selected points. Okay. So whenever you are studying this repeatedly, you will get these points very easily, and it will be easy to remember. Okay, I think this is enough for this class. Today's class, my health is not allowing for taking much more time today's class. Okay. So we will on the next week, I will take the class. Okay, so you have to attend the whole exam. Okay, that is conducted on the weekend days. And if you have any doubt, you can ask at any time. Okay, so keep on studying. Okay, thank you.